We shall take up general diagnosis of face, red complexion, white complexion. There are two aspects to observe when conducting face reading: the color radiance and physical form. Complexion is likened to a thermometer that helps one understand his or her health status. By observing the changes in the color and radiance of one's facial skin, one can tell whether the Zhang and Fu organs are in a state of deficiency or excess, the qi and blood are prosperous or on the decline, the nature of the disease is a cold or heat type, and the severity of the disease and its prognosis. All of these combined can lead to a conclusion about whether a person is healthy. Diagnosis through inspecting the complexion is mainly carried out by observing the changes in the color and radiance of the facial skin. When looking at a person's complexion, it is important to compare the color during illness with its normal color and compare the patient's skin color with that of a group of peoples to arrive at a judgment. Second, observe the change in the radiance of the skin color. When a change occurs in the pathological development, the radiance of the facial skin changes. Third, judgment should be primarily based on the general complexion of the patient, but its radiance and moistness or dullness constitute the key basis for judgment. In addition, face reading should not be confounded by factors unrelated to diseases. For example, no face reading should be conducted right after physical exercise. There are mainly four types of complexions, but we shall only discuss the first two. Red complexion. When the facial skin is red, it generally indicates that there is heat in the body. Qi and blood flow smoothly when they are warm. When heat is abundant and blood vessels are full, the color of the blood is reflected in the skin, making the face red. When accompanied by a red swelling and sore throat, it indicates exogenous wind heat attack, that is, wind and heat combined invading the human body. A very red edge of the face indicates heat in the Yang-Ming meridian, one of the 12 principal meridians of the human body. Heat in the Yang-Ming meridian refers to the exuberance of heat pathogens pervading the Yang-Ming meridian. When accompanied by insomnia or irritability with hot sensation in the chest, palms, and soles, it indicates endogenous heat due to yin deficiency. Yin is only deficient when compared with the normal state of yang because when yin, which is cold in property, is insufficient, yang, hot in property, becomes excess as a result, and a general relative heat condition is established. A pale complexion with redness in cheekbones, accompanied by shortness of breath, limbs cold up to the elbows and knees, indicates long-term illness leading to yang deficiency and yin exuberance, that is, excess of internal yin leading to damage of yang. White complexion. When a person's complexion lacks the color of blood, this person is considered to have a white complexion because the lack of blood results in the failure of nutritive blood to nourish the face. White mainly indicates a deficient cold syndrome and a syndrome of blood deficiency, which are the result of the deficiency of both qi and blood, leading to failed nourishment of the body. Pale complexion, weight loss, and lightheadedness indicate an internal blood deficiency. That is, there is not sufficient amount of blood in the body to fully nourish Zhang and Fu organs, the meridians and collaterals, and the physical shape, nor can it sustain the normal mental activity of a human being. Dullness in the complexion and general malaise indicate the decline of yang. A pale complexion and severe abdominal pain indicate internal hyperactivity of cold, that is, pathogenic cold, invading the body and damaging yang, which leads to retention of pathogenic cold in the body. Pale complexion, profuse perspiration, but feeling cold, and limbs cold up to the elbows and knees indicate a sudden depletion of yang in the body, or what we call yang deficiency. Thank you for your attention.